Good afternoon, and honestly, I'm grateful for this opportunity, thanking the organizers of this conference. It is a wonderful privilege with great humility, respect, and all appreciation that we've been granted this sport. As it's been mentioned, I'm Tebello Lepheane from the Kingdom of Lesotho. I'm not sure if many of us will understand geographically where Lesotho is. It's a little tiny kingdom in the middle of South Africa, down at the bottom towards Cape Town. We are a kingdom governed by our Prime Minister. We have got a king, and we are 2.1 million in population. That is where I come from. But at the moment, I'm serving at Queen Elizabeth Hospital in Birmingham as a registered nurse with a great passion in palliative care, simply because the moment I came to UK, that is when my eyes opened. I had no idea of any word like palliative, hospice, proper pain management and all that, simply because we don't have such services in Lesotho. And you can just imagine the suffering that is there, which as Starlight, Oasis of Hope, me being the founder and our trustees, we have got this shared vision to make sure that we establish such care back in Lesotho. We are a UK registered charity, and we have got a great appreciation for this community here in Wales, because we have had through these networks, through this environment, during the high seasons of COVID, through the online communication conferences, we were able to get more network of people that had similar interests, and as a result, we were guided through, and some of the members from the Dolan family, they were very much interested in supporting us, simply because they have got strong links with our country spanning over 35 years. And as such, we have had a breakthrough in registering the organization. So I would definitely humble myself this moment on to the giver of time that we have had this opportunity to share, the time being the greatest gift of them all. And I will just proceed quickly. As we are a palliative care and a hospice initiative, we have really indeed found the theme of this conference very much aligned with what we do. As the name says, we are Starlight Oasis of Hope Hospice. We have found ourselves to be standing in the gap to address the issues in my home country, simply because patients and their families are always distressed, not knowing where to go when they are given the palliative referral from South Africa. In the background of all this information, Lesotho doesn't have a national cancer control center. All the cancer patients are transferred to South Africa, and as such, they can be on the waiting list 8 months, 12 months, and by the time they are called in, sometimes they are no longer treatable, some have already died, some have been suffering unnecessary pain and discomfort, and by the time they get there, they are referred to for palliation. They go back to Lesotho, they don't know where to go, who to ask, where to find support, no morphine in the country. It's just something that when I came here, it became a burden of mine to feel that if I'm here and I've been exposed to the services and what is possible in that kind of disease category, what can I do as a person? Because in this journey of life, empathy is all that human beings are. It is our DNA to look after each other. Therefore, I felt I needed to do my responsibility, not to moan about what the government is doing or it is not doing. And that is why I appreciated this theme of this conference, because we are transferring all that we are from being compassionate, sensitive, loving, and caring human beings to actually transfer that from the egocentrism moving it out of our ethnicity and then moving towards being global citizens, whereby we will be concentrating on how we can impact one another within the health space wherever in the world is possible. So I am grateful, as I mentioned, that with the links from the Welsh community, we have been able to get all the support we needed to register the charity.
Bear with us, just some technical issues.
Yeah, it's not showing there.
Apologies all.
Thank you very much. Yeah. So moving to the next slide, empathy to us, it translates as a brotherly love, looking after each other and looking after ourselves, being empathetic to us as human species, as well as translating that to the communities around us, to our own colleagues here where we are and globally. And when I looked at that picture, I don't know what comes into your mind, but to me, it provoked something very personal and deep, such as who am I in that space? We see people that are seeming to be looking after each other's interest with all honesty and with a caring perspective. So as such, as communities in Lesotho, we have tasted time and again the empathetic culture that emanates from this city, with many of the Welsh teams that have been up and about in Lesotho, whether it is in the health sector, supporting education sector, or culture. And indeed, for me personally, knowing the circumstances, the situation, the road conditions, the safety conditions, political instabilities, or anything that an outside would be concerned about, that I always feel so much appreciative of the nature at which people sacrifice their time, their comfort, their safety, to actually share their time, their skills, and everything they have got with the people outside these wonderful kingdoms. So for that, I will always be grateful. So in terms of realizing the need in Lesotho, we have embedded our heart in advocacy. And you cannot advocate without having an empathetic spirit, the loving spirit, the compassionate heart. Recently, we have just launched our initiative back in Lesotho in August at the Royal Palace, because the Her Majesty Queen is our patron. And from there, I went to Uganda. There was an International African Palliative Care Association conference. It is through that conference that Dr. Ali really uttered those great words, which I felt they were very much aligned with what we are trying to establish, which I believe all of us share as health professionals, or as human species, I should say. Without empathy and compassion, you will be doing advocacy for nothing. And advocacy comes in many forms. And ours was just to see that we can stand in the gap, carry that burden in our hearts, be empathetic and feel for the patients and their families, whether it's a young child, a youth, men and women, regardless of their income. Unfortunately, Lesotho, where I live, where I'm coming from, it falls under those countries that are called lower to middle income countries. And if you look at the statistics from World Health Organization, there's a projection that is clearly stating in 2060, 39 million deaths will be associated with non-communicable diseases. And as such, cancer, it is on the rise in Lesotho, although unfortunately, statistically, we don't have the clear figures because we don't have cancer registry. As I mentioned, everything else takes place in South Africa. But the estimated figures looks like nearly 3,000 to 4,000 of new diagnoses each year. And World Health Organization states there will be those 39 million deaths each year from 2060. And most of those deaths come from lower to middle income countries, which will be like 83% according to their estimates. And therefore you can tell that being empathetic in the journey will help us to actually become aggressive in every effort and plan and strategy to try and stand in the gap, provide pain medication, support the frontline staff with basic palliative care skills so that they can be able to be empowered and equipped enough to break the bad news to those that are affected, and as well as providing counseling for the patients and their families, and to make sure that we continue in that advocacy within Lesotho, where palliative care is not really being heard of much. So it is a great hard work, working against so much resistance of power and everything you can name it, to get the understanding in the Ministry of Health, within governments, communities, and ordinary citizens. And luckily enough, through that advocacy, we have been able to break through. In 2017, the government of Lesotho, through Ministry of Health, was able to understand our heart, and therefore we started negotiations, and at the moment, we were able to secure the Memorandum of Understanding from 2018 that they see what we are talking about, and they can identify the gap we spotted, and they are willing to cooperate and work with us. And we hope that will grow from that onwards as they see the demonstration of the need for palliative care on the ground. And we can all understand how much distressed our communities were during the COVID season when we don't have hospices, we don't have palliative care. So in the journey of expressing our empathy through advocating for the people of the Kingdom of Lesotho, all we have been doing, which we feel will bring about change, was all about communicating the needs on the ground, empowering patients so they know what they can really access from Ministry of Health, that there's something like morphine if I suffer pain. Because the trend in Lesotho has been painkillers, has been paracetamol, regardless of whether you have got mild, moderate, or severe pain. That has been. It is only recently that tramadol joined the cycle, but morphine is still a great challenge. And as we know statistically and scientifically, morphine has been proven to be the cheapest, especially the liquid one. And again, it has been proven to address all the pain, the cancer pain throughout the journey, including those with life-limiting illnesses. So where we are at the moment, by the grace and support of our links here in Wales, we have really progressed along that path. At the moment now, we are trying to implement the solution by trying to source funding. We already got the land in Lesotho. We have been granted the land by the chief at the local community where I live. So at the moment, it's just to get going and get the bricks on the ground, get the vehicles to the people and their families, and integrate with all the stakeholders on the ground in Lesotho, regionally and internationally. And through this journey, we have been able to get access to international newsletters so that we can time and again share our story, share the challenge on the ground. Who knows who will be willing to volunteer with their time and skills to actually support us as we get ourselves on the ground, or even linking us and directing us to the right channels to get the funding we need to make things happen on the ground. So during our launch, we were able to share our story through Hospice and newsletters in America, the International Association of Hospice and Palliative Care. So in Lesotho, the greatest needs are very clear, is that the palliative care services does not exist, and we need the services to help people in the communities, integrating and collaborating with the village health workers and the public health teams, as well as having services in the hospitals, getting the palliative care teams, liaising with the whole multidisciplinary team to explore how best we can address the needs of the patients holistically. As we speak, it was 2012 when Minister of Health and Social Development decided to part ways. They used to be, originally it used to be under one ministry. So when they part ways, there are so many things that happened there, and the patients are falling in the gaps that exist. You'll find that the patient who has been on an ongoing challenge with their life-limiting illnesses, be it cancer or anything, by the time they lose their ability to mobilize, or they might need some working aids or anything, or they have lost their jobs through the progression of disease or their income, they haven't got anywhere to go, and there's no system to pick those people, do social assessments so that they can get the social grants, be it short-term, medium-term, or long-term. So what we have done through this advocacy, in March when I was at home, I approached the Social Development Ministry, laid down our observation and how we feel we can make a difference, collaborating with them and other relevant ministries such as health, to see that our people, their needs are identified early, referred on time, and get the necessary support. So we are just in that journey to explore the possibilities of a memorandum of understanding to see how we can get going. So indeed, 2017 Atlas of Palliative Care that was showing how African countries are doing. It clearly stated Lesotho has got no budget for palliative care activities within their national health budget, and it still stands even now. We are doing our advocacy is an ongoing journey. But it is driven by the currency of all, that is the empathy, the compassion, the love, and feeling for those that are in need. That is all that is pushing us. Otherwise, it could have easily been something that you can just pack it on the side and get going with your life, because it's been a hard struggle for these past 7 years. So the cancer journey in Lesotho, it is very, very unpredictable. As you can see, the gentleman on top of the hill does not know where to go. The roads are just anyhow. You can just make sense of how confusing it can be. There was a time that they said care would be cheaper in India because of the currency there, and people were sent to India. The flights would take them. When they are there, there's no more air ticket to bring them back, or where they have hired the motel to keep them and their families while they are going for the chemos, radiotherapies. Nobody is paying, and they are checked out and they sleep on the streets. So it was very, very challenging. So as such, that stopped. Now we continue with the South African journey. Even that South African journey, patients can be there by 5 a.m. In very strong bitter winters, they will be there 4 a.m., 5 a.m. to catch the coach to South Africa. The coach, they will be there. Some come from a far hard to reach areas. Lesotho, by the way, is a very highly mountainous country, very high altitude, and we have got cold winters. So they will have come from their far distance districts. They will have slept wherever, and then they will go there. Sometimes even that vehicle will arrive 8 o'clock when they should be in South Africa for their 8 o'clock appointment. By the time they get there, 12 o'clock or 1 o'clock, they've missed their appointments, no review, missed chemo, nobody will have checked them. So even the little top-up that they normally get of morphine from South Africa, as nothing is available in Lesotho, they'll have missed out on that one. The next appointment, only God knows when. So our journey has been, the dream has been to move and proceed. As we have now been registered here in UK, registered in Lesotho, we are looking at an upward journey to actually make things happen so that the difference can be felt by the patients and their families. However, challenges, barriers, opposition, delays, and the obstructions along the way, and disappointments is just part of the journey. But empathy is what is energizing what we do, and we are on this side. The reality is that we are on the forward journey. We are still going to make it happen. And it's just an encouragement to us all that as we are talking about this theme, many of the conferences I've observed this year, post-COVID, we have all realized how we are needed, how each one of us is part of one another, and how we can really map up the caring attitude, ignoring the distances between ourselves. The help, the support, Zoom and other platforms had made it possible for people to link across nations, across continents, and share their experiences and journey and become source of support. And for that, we are still ongoing. And this community here in Wales, the links that exist here have been so fundamental to us as Starlight Oasis of Hope that we were getting assurance, support, and honestly, that it was all that we needed to push through to where we are today, and for that we will forever be grateful. If we take the center ground of the human foundation, our heartbeat and DNA of being caring and compassionate people, I do believe that if the nations, the leaders, those in the decision-making capacity could embrace this theme of empathy, running from being one person to the next one and globally, from interpersonal and to the global environment. It does mean each and every nation would quickly proceed and do well in all these SDGs. And I just hope that even those that are not in this room, who would have access to what has been shared, would really take ground and understanding of the heart of Dr. Kelechi, because I picked up so much wonderful stuff that reminds us that we all need each other to make things happen and make life more enjoyable for all of us. So our intention as Starlight Oasis of Hope is all centered around this vision and these values. And in our journey, it's just all about making sure we support those that need care. And we have been patient and will continue to do so to actually deliver the patient-centered care. And we are just, like Dr. Kelechi was saying, there might be an overlap between empathy and compassion, and indeed it is what is happening with us. We have expressed that is what has driven us to take the steps we have already mentioned. And therefore, it is just from the diagnosis towards the end of life or towards survivorship is all we are hoping to achieve. And those are our priorities. And one of them is just to empower the frontline staff through training and support, and even training the informal carers, village health workers, where we have them in Lesotho. And through this empowering of frontline staff, We are working with Dolan family, and Dr. Ian Hobbs is here. He will say more about that, because we are working together to deliver those trainings to the doctors that are training in family medicine in Lesotho. We did an online training in 2020 because we believe they are the key people as well to make things change on the ground. They are the ones that can be able to be comfortable and prescribe morphine. And if there's more prescriptions that require morphine, that within the Ministry of Health, that can become an internal advocate to show these patients, this number of patients could have easily been managed with a morphine, but we didn't have, we had to resort to Tramadol, but it is not addressing their pain. So that internal move with the external energy can gradually bring about change and change of perspective and understanding. So that is our journey. We progressed from being just a consultancy organization under the name of Starlight Palliative Care Services, which was just about advocacy within Ministry of Health in the public space and all that, and training the staff. But then we realized we have to quickly, naturally progress to actually trying to deliver the care, because the suffering was still ongoing, as there was no budget for us to train the staff, and therefore we had to really push through to now become a registered charity and incorporate all the ideas I had with that consultancy organization to actually transfer everything into the heart of what Starlight Oasis of Hope is. And indeed, we have launched, as I've mentioned, in August 2022, and we continue to enjoy the support, which we have now been exposed to a lot of information during the workshops as to how much support is available within the Welsh community, and we are grateful. So these are the operational pillars that we are pushing to support Lesotho. Advocacy is all what we are still continuing to do. It doesn't need money. It's just to get a free radio slot in Lesotho. And I do the radio interviews from this side, and time and again, week on week, I do those awarenesses about cancer, about palliative care, about hospice care, about morphine and all that. And things are really gradually changing, the understanding on the ground, and people are beginning to appreciate and get an idea of what we want to do for them. Capacity building is what we are trying to do. We're delivering online trainings to frontline staff and do everything we can through our website, share information, leaflets, and all that. And when we are on the ground in November, we will be doing that. But we already have a planned event early next year to train the frontline staff within Ministry of Health for the 10 districts, at least if they can identify 2 palliative care champions, so that when we continue to do training, we don't train different people each round. We can just have the assigned people. So we are working with the ministry to identify those people. So the care and support will be there when we are on the ground, deliver all the holistic care that will address their physical challenges, psychological, spiritual, and social challenges. Treatment is just towards making sure the medications are available. If they need the tracings, that is also covered. Am I still good on time? Oh, 3 minutes, okay. I'm almost done. So that is our strategic journey, and we are on level 2 now, still continue with the advocacy and identifying fundraising opportunity. This is one slide that I thought I should share, this quotes. It always seems impossible until it is done. That is Nelson Mandela. And as well as the empathy journey is for us all. This quote from the founder and the father of Methodist Church, John Wesley, do all the good you can, by all the means you can, in all the ways you can, in all the places you can, at all the times you can, to all the people you can, as long as ever you can. And it's all possible with the links that we are establishing here in Wales to be able to do and see the opportunities that exist to support all that is within us, empathetically and compassionately share with them so that we can be supported accordingly. And that is our story, and we are grateful. Thank you for this opportunity and privilege. I'm not sure if there's any minute for a question, but that is us. Thank you. One minute. Any questions? With the morphine, we are still at ground zero. So it is only 2 weeks ago when we had a first meeting with the Ministry of Health, with the Sankatana Clinic, to actually establish where we are with the Director of Pharmacy in establishing and increasing the quota for the country, because these meetings have been proposed each time and they have not been able to honor the meetings we initiated. Before the launch, we sent another advocacy letter for morphine. They couldn't meet me or give me a slot while I was in Lesotho. When I came this side, they gave me a date. We were with them. Unfortunately, the Director of Pharmacy and Pharmaceuticals was not in the meeting. So they are planning the second round of the meeting so that we can hear from her and her team, and then we can take it from there, because the idea behind this advocacy for morphine was to see how we can get help from African Palliative Care Association to get the liquid morphine, or just have a small plant that can do the reconstitution of liquid morphine. Thank you. Thank you very much.